Addressing Nicotine Dependence in the Workplace, a sales presentation for employee assistance professionals by Duncan for BUSI 528 at Liberty University. Hello, and thank you for meeting with me today. As an employee assistance professional, you support the health, performance, and safety of your workforce every day. One growing challenge in today's workplace is the rise of nicotine dependence, especially from modern products like nicotine pouches and vaping devices, also known as e-cigarettes. Today, I want to show you, through 3 sales approaches, the risks of nicotine dependence in the workplace and how our nicotine dependence program can support your workforce and partner with your EAP services. Why nicotine dependence matters for employers. Vaping use continues to rise among young adults, especially working age adults, including never smokers. Never smokers are individuals who never smoked traditional cigarettes but have begun using vaping products. Modern products deliver high nicotine doses, both via vape pens and nicotine pouches, leading to dependence. Vaping use is increasing even as cigarette use declines. However, workplace policies often do not cover vaping. Vaping is linked to increased absenteeism, costing employers productivity and creating staffing instability. Impact on employee health. The marketing of tobacco-free e-cigarettes causes people to incorrectly assume that these products are nicotine-free and that the risk from use is lower than traditional tobacco products. However, nicotine is a highly addictive substance, making it difficult to quit. E-cigarettes may have the potential to be more addictive than traditional cigarettes. These products are not harmless alternatives. Tobacco-free does not equal safe. Vaping is linked to many medical issues, including respiratory, cardiac, and mental health effects, as well as sleep disruption. And nicotine pouches, which deliver rapid and very high nicotine doses, similar to or higher than cigarettes, are also dangerous. Long-term oral health impacts remain unclear, but the current evidence shows early concerning signs, including concerns for oral cancer. Impact on organizations. Urban et al. 2025 provide the first national-level evidence showing that nicotine vaping is linked to increased absenteeism. Even occasional or past vaping correlates with more missed work, highlighting vaping as not only a health issue, but also an economic and workplace performance issue. Their study found that greater than 10% of full-time workers reported past month nicotine vaping. Compared to non-vapers, employees who vaped had higher missed days due to illness, higher skipped work days, these are considered behavioral absenteeism, days missed not related to illness, but due to unknown reasons, and decreased productivity from withdrawal-driven breaks, distraction, and work disruptions. These patterns are strong enough among U.S. workers to suggest significant impact on workplace productivity. Policies addressing workplace vaping and offering cessation programs could help reduce absenteeism. Policy gaps. According to a study by Quinn et al. From 2024, approximately 40% of surveyed occupational health professionals said their workplace did not include vaping in its tobacco-free policies. 90% of organizational leaders support adding safety measures, but lack the guidance on how to implement this. Many workers underestimate vaping risks, and e-cigarettes are often not included in the smoke-free workplace laws, with only 6 states including them explicitly. Our program is comprehensive, modern, and employer-aligned. We offer cessation support with medication and counseling, vaping and pouch-specific counseling, policy and supervisor guidance, employee education and support, progress tracking, and an optional 60-day EAP pilot. The problem is real and rising. 1 in 5 U.S. workers use tobacco or nicotine products, with even higher rates in industries with rotating shifts, irregular schedules and hours, and high-stress roles. We all know someone who struggles with nicotine dependence at work, don't we? Yes. Modern nicotine products are stronger than many people realize. Nicotine pouches and vapes deliver unexpectedly high nicotine, sometimes exceeding cigarette levels. You can see how someone might become dependent on these products very quickly, right? Yes. Employees frequently underestimate the risks. Packaging and tobacco-free labels lead users to see products as low risk. You want your employees to understand the risk and see beyond the marketing gimmicks used for these products, correct? Yes. These habits affect the workplace. Vaping is associated with more missed workdays due to illness and more skipped shifts. Is it time to start addressing these productivity and staffing impacts in your workplace? Yes. EAPs often struggle with helping employees quit, managing policy questions, and supporting supervisors. Your workforce is facing rising nicotine use amongst working adults, confusion and compliance issues around workplace vaping policies, and productivity loss tied to nicotine-related absenteeism. Here's how our program solves those challenges. We provide evidence-based cessation support, employee and supervisor education, and assistance in updating and clarifying workforce policies. Would improving employee health and reducing illness-related absenteeism and skipped shifts due to nicotine dependence benefit your organization? To address some concerns, employees do want to quit. Vaping and nicotine pouches are not safe alternatives to cigarettes, and supervisors need training and organizational support to confidently address nicotine use at work, and we are here to provide that. This approach starts with you, your challenges, your workforce, your concerns. We design a program around your needs. We're supportive and not judgmental. Using motivational interviewing, relapse support, and personalized plans, employees will feel supported rather than punished. If your organization needs clear, enforceable policies, we can help you update and clarify vaping and nicotine policies. If your organization needs healthier employees, we provide evidence-based vaping and nicotine pouch cessation support. If your organization needs better attendance and performance, we target nicotine dependence to reduce absenteeism. And if your organization needs a safer, more consistent work environment, we train supervisors and staff on best practices. Our recommendations. We recommend that we work with you to launch a 60-day pilot to introduce the program and assess initial fit, provide initial training and ongoing support for supervisors and employees, evaluate engagement, nicotine quit attempts, and policy alignment throughout the pilot, and hopefully establish a long-term partnership based on results and organizational needs. Nicotine dependence, whether from vaping or pouches, is affecting your workforce more than you may realize, but with a structured program, evidence-based support, and meaningful partnership with your EAP, we can reduce absenteeism, improve employee well-being, and strengthen your nicotine-free culture. We look forward to partnering with you to strengthen employee health and workplace performance. Thank you.